Hi, everybody. First and foremost, thank you all for being here. Not sure if it's noon or in the morning somewhere, wherever you are, but I greatly appreciate you you being here to talk about FIC with me. And first of all, I want to thank Assisi Animal Health for having me present today, but more importantly, for providing the continuing education that we've seen truly over the past 2 years, really before, but then especially since the pandemic has started, they've provided a number of continuing education sessions for the entire veterinary healthcare team. And we know how important that is. So, so thank you to Assisi Animal Health for not only the CE, but for everything you do for pets and those of us who love to help them. So, as I mentioned, we are going to be talking about feline idiopathic cystitis, and we're going to look at some different ways to hopefully help with inflammation, definitely stress and pain. So let's kick this off by talking about inappropriate elimination. And so we really know that inappropriate elimination is one of the most common reasons for which owners come to us as veterinary healthcare team members. But unfortunately, it's also a common reason why pet owners relinquish their cats to shelters. And so obviously we want to help these cats and to continue the human-animal bond, because we know that feline lower urinary tract diseases or feline lower urinary tract syndrome can have a huge impact on the pet and family bond, right? Most of our clients today believe that their pet is a member of the family. And, to develop an issue or a disease condition that falls within lower urinary tract disease or lower urinary tract syndrome is going to put some serious pressure on that. We do not want them relinquishing this family member, right, to the shelter. So it's up to us, our role as veterinary healthcare team members, be it the veterinarian, the veterinary assistant, the credentialed vet tech, the front desk team, right? All of us have a role in helping to prevent and really manage feline lower urinary tract disease. So if I were to ask you, what are some of the causes of lower urinary tract disease, lower urinary tract syndrome? One of them obviously is in the title, right? So what else would you say? And for those of you who have been with me before or maybe seen me in person, I like things to be very interactive. I understand that's very difficult, or maybe more difficult, I should say, on a webinar. But hopefully, you guys are thinking right along with me and saying, based on some studies, if we look at the causes, if you will, then we see that, uroliths crystals, right? The struvite crystals, calcium oxalate, those make up about 20%. Plugs, again, those struvite plugs, and the majority of them are struvite, 15%. 5% is always gonna, or I should say, we're always gonna have some miscellaneous, right? We always see that category, but this is for the anatomical defects or maybe neoplasia, right? It falls into the 5% miscellaneous category, which leaves us then with 60%. So 60% of lower urinary tract syndrome is really, caused by, well, we're not really sure, right? Because it's feline idiopathic cystitis. And you guys know better than I do that means we're not 100% sure what's causing it, but we have some ideas. And it's those ideas and those, the reasoning that we are going to look at some management principles today. So for the veterinarians on here, what is involved in your diagnostic evaluation? What diagnostic tests do you most often recommend? And granted, I know it depends on the cat's history and the owner's level of frustration and the owner's level wanting to have an answer, right? But hopefully you said a urinalysis and some form of diagnostic imaging. I'm sure that's what you said, because, basically, if we are talking about diagnostic evaluation for feline lower urinary tract disease, then yeah, we are talking about a urinalysis, abdominal radiographs, or an abdominal ultrasound. And then if the cat is older, yes, it would be appropriate also to do a urine culture. So then let's take a look. This is SOX. And we're not going to delve real deeply into SOX, but let's, on the surface, let's take a look at SOX as a case. SOX is a 7-year-old female spay domestic short hair, as you can see. SOX has had recurrent episodes of polyuria and hematuria. If we were to look at the urinalysis findings, is anything really jumping out at you here? I've heard, okay, the occult blood result, but, if we're looking at this, the cat doesn't have any crystals. Does that mean that she doesn't have any uroliths? Well, no. Often cats with uroliths will not have crystals in the urine because they're all maybe part of the stone, right? So, okay, so we're not seeing crystals in SOX's urinalysis, but we're still, we still need some diagnostic imaging, right? To better define the cause of lower urinary tract syndrome in SOX. And so what do you see here? Anything? This is SOX's lateral abdominal radiograph. And, I'm not a radiograph expert. I'll leave that to you guys. But, just looking at this, I don't see any obvious cause for SOX's clinical signs, right? Yes, it's possible she could still have small uroliths that aren't radiographically apparent. But I'm going to ask you, based on what you've seen so far, what are your thoughts? Okay, you've seen diagnostic imaging and you've seen a quick urinalysis. So I'm going to say, and hopefully, you're with me here, that the most likely cause for SOX's clinical signs is FIC. So that being the case, what do you as veterinarians or what does your hospital team recommend for this cat that initially looks like it has FIC? And so I've listed, some of them here, or I've put pictures of some of them here, right? So analgesics, amitriptyline, environmental enrichment, right? We can go through all of these. Obviously, you heard that I'm a nutrition technician and we will be focusing on nutrition. But, part of nutrition is increased water intake, maybe canned food, omega-3 fatty acids, right? So, and then we have type A proanth, yeah, so we'll just say PAX, pheromones, and then, yeah, therapeutic urinary food. So most of the treatments on this list have been used in cats, and you probably use them yourselves. But most have not been evaluated in a controlled study, or have been and were not shown to be effective. So truly, no matter what you do, or don't do, what has been shown is that acute FIC episodes last 3 to 7 days. And so what is our goal of therapy? I think that you're going to say one goal is to make the cat more comfortable during an episode, right? So what we want to do is decrease or help to decrease the number of painful days. So we're going to look at some management modalities that have evidence of effectiveness. But first, I want to talk about lower urinary tract syndrome and nutritional management as a whole. Then we're going to get into specific nutrients for FIC and stress-related components of FIC. So if we are looking at key nutritional factors for our fluted cats, right, we want controlled levels of magnesium, calcium, phosphorus, and oxalate. And why? Why do I pinpoint those? Because if we can reduce those building blocks of crystals in uroliths, we're doing right by our patients. We want to add citrate because it inhibits crystal and urolith growth. And enhance vitamin B6. Vitamin B6 is going to help decrease oxalate formation and excretion. And then we also want to consider antioxidants. I'm sure that you hear quite a bit about antioxidants in humans, right? Every time we open a magazine, or oftentimes when we're, if we're watching TV and an ad comes on or a commercial comes on, talking about antioxidants. So vitamin E and beta carotene are going to counteract oxidative stress. And it's going to help to generate an environment that's unfavorable, again, for the development of uroliths. And omega-3 fatty acids, which we mentioned a little bit earlier, help to break the inflammatory cycle. Is there an inflammatory process going on with feline lower urinary tract disease? Absolutely. And so it absolutely, again, makes sense to use omega-3 fatty acids as part of the nutritional component for helping to manage lower urinary tract disease. So I talked about evidence, right? What has the best evidence for helping to manage FIC? And we've talked a lot already about, things that our practices, our hospitals, and you as veterinarians are using and recommending. But, if you were to look at this list here, which do you think has the best evidence for managing cats with FIC? Well, if you've mentioned these three, then you're correct. So yes, we do have evidence that supports environmental enrichment, moist foods or canned foods, and therapeutic urinary foods, be it dry or canned. So let's look at environmental enrichment. And I think this is huge. And we need to be talking, I hesitate because our veterinary technicians should be talking to owners about environmental enrichment. I think you as veterinarians bring that up, talk to, mention it to the owner, but then turn it over and let the veterinary technician talk about it. So what does it entail? We need to be reminding owners that they should be providing opportunities for play and enjoyable activities such as scratching posts, which you see here, and toys. We should also be encouraging places to hide or rest. So in the form of like kitty condos. We should also be talking about food and water dishes. And I think we've gotten way away from this because we think it's common sense and intuitive. And yeah, I'm with you. It should be, right? But do we talk about how often they should be cleaned or where they should be kept? No, I think that was a general no. I'm sure some of you are doing that, and kudos to you and thank you for doing that. We need to get all of our colleagues across the US talking about location and cleanliness. and opportunities for play and providing enjoyable activities for our cats. So here's some of those, kitty condos that I was talking about. And you don't have to encourage they get one from floor to ceiling, right? But just have them start thinking about different places in the house where can their cat get away, just get away from it all, right? Maybe a smaller one. And how about some interactive toys like we see up here in the top right? We also want them to be cognitively stimulated. So, games such as this where they have to, reach to hunt, if you will, to get the toy or the, the fake mouse in there, or the motorized mice where they have to chase them. We're trying to mimic as best as possible their usual environment, because rightly so, we're bringing cats inside, right? And when we do that, we have to provide these opportunities for enrichment. Litter box recommendations. If I have 3 cats, which I do, right? How many litter boxes should I have? I'm sure you all just answered 4, right? Because, it's typically 1 litter box per cat plus 1. And we should also be talking about the characteristics of a litter box. It should be 1.5 times the length of the cat. It should have lower sides for older cats. Because if you have a cat with osteoarthritis who cannot get into the litter box and starts, soiling outside of the litter box, the owner, the team may be thinking, oh, some type of urinary tract disease, when it may be due to arthritis. So again, these are just things that we need to think about as healthcare team members and talk to our owners about. It has been shown that environmental enrichment does help reduce lower urinary tract syndrome or disease. Many behaviorists have looked at cat litter, and they have found that the majority of cats prefer litter that is clumping and unscented, right? The scent is for the owner. But think about it. Would you want to be, have that much scent close to your olfactory? No. So again, we need to just think this through and truly talk with our owners. And then litter box maintenance. I've seen some scary litter boxes, and I'm sure you have as well. So we need to talk about, where they put their litter box and their food and water. Are they putting it next to the dog crate? Are they putting it, in the laundry room? And then, the washing machine goes on a spin cycle and scares the cat half to death, and they're never going to go in there again. And are they cleaning it, right? So we definitely need to talk to them about proper hygiene for their litter boxes as well. And then, as I mentioned, this isn't probably the best litter box, but it looks nice, right? So owners are going to be like, oh, hey, that's kind of cool. Look at how nice that looks. But in my house, and I'm sure in many other houses, if I had one of these, one of my cats would be here. So when this guy comes out, this one would attack him, playing, but who wants to be wrestled with after they've gone to the restroom, right? After they've gone to the litter box. So these are things that we need to be thinking about and talking to owners about, because this thought process will help our cats with lower urinary tract disease. And so what you see here is some of the evidence that I was talking about earlier. Results of a clinical study evaluating environmental enrichments in cats with FIC. And this was a prospective uncontrolled clinical study of 46 indoor housed cats. So it's grade 3 evidence. And what was found was, significant findings, reductions in lower urinary tract signs, fearfulness, and nervousness. And you'll see that, why I'm mentioning fearfulness and nervousness, especially as we get, as we move through this and talk about stress and FIC. And so for you, as veterinary healthcare team members, as well as for your pet owners. The Indoor Pet Initiative, which you see up here, you can go to indoorpetinitiative.org, or you can go to indoorpet.osu.edu. This is an excellent resource for more information on environmental enrichment. And again, it's for veterinary healthcare teams, and they also have resources for pet owners. So I mentioned canned food. And is there evidence for canned food? Well, let's take a look. So this was a non-randomized, again, unmasked prospective study of 46 cats with FIC that were followed for a year. And, you know, there were two groups in the study. One group of 28 cats was fed a dry version of a urinary food, and the other group was fed the moist version, or the canned version. And the cats were evaluated at 2 weeks and at 4, 6, and 12 months. And what was found in this study of 46 cats with FIC showed that recurrence of clinical signs was significantly greater in cats fed dry food compared with cats that were fed the canned food. In fact, the percentage of cats with signs was found to have decreased in those cats fed the canned food. What about water intake? I think many of us talk about water intake when we have an FIC or a fluted cat in general, right? Do we have evidence that support methods to increase water intake in cats with FIC? Well, if we see here, as I mentioned, there's a lot of emphasis on increased water intake in cats with lower urinary tract signs. So if the goal is to dilute urine and increase urine volume, the single most effective way to do this is to feed moist food, not a mixture of moist and dry, and not dry food with increased salt. So as we see in this table, a summary of the effects of feeding moist versus dry food to cats. And the cats fed the dry food drink a lot more water in addition to their food. However, the total water intake still doesn't equal the amount that occurs when feeding canned food. So I think you can see that here. And urine volume is greater in cats eating canned food. In fact, in this study, the urine volume was twice as much as cats eating dry food. So to increase urine volume, we should be recommending feeding canned foods. Having said that, I also want to remind you that there is evidence for therapeutic renal foods. And this is the only randomized double-masked controlled clinical trial that has been evaluated looking at the effect of nutrition on cats with FIC. And so what we see here is the episodes per 1,000 study days, okay, and the control food versus the therapeutic renal food. And just in this instance, it was CD Multicare, not promoting, just reiterating the this study. And so compared with the control food group, there was an 89% reduction in the rate of recurrent episodes of FIC in cats that were eating the therapeutic renal food. So in this study, therapeutic nutrition was associated with an 89% reduction in the rate of recurrent episodes of FIC signs. So there we have three, right? Three different studies showing or supporting some of what we do and what we recommend on a daily basis, right? Environmental enrichment, canned food, and therapeutic food. We know that if we can implement and manage with one of those three or a combination of those three, then hopefully we'll be seeing fewer painful episodes. And fewer painful episodes means less struggling in the litter box and living really in the litter box. And more of establishing and strengthening, rebuilding almost, if you will, that human-animal bond. So let's take a little turn and talk about stress, because it's easy to recognize stress in this cat, right? Yeah, this cat is showing the typical flight, fight, or freeze response. We don't have to think twice that this cat is stressed. But what about this guy on the right? This guy also is most likely suffering from effects of chronic stress. He's gone off to hide, and he also is at risk for FIC. Many times the signs of subtle, such as what you see on the right, such as hiding, may go unnoticed by pet owners. I would say probably most of the time, until we start doing an in-depth history and asking the questions. So what are some of the risk factors that are consistent with stress? I mentioned a couple of them earlier. Nervousness, fearfulness, right? Hiding from visitors. Cats like their environment. They don't like it to be interrupted. So they don't want visitors coming over. They don't want anything in the house moved, let alone, a complete move to a different house. But even moving furniture around is stressful for cats. So what are some common anxiety triggers in cats? Well, 3 of the most common triggers for anxiety are people. So again, visits by strangers is the most common trigger in greater than 50% of anxious cats. So here they're avoiding people, they're hiding, they're running away, right? They're crouched and their tail is lowered. And then how about the middle? Sounds. Typically sudden noises were, another common trigger. Sneezing, loud talking, loud music, thunderstorms. We think of storm phobia in dogs, but do we think of storm phobia or those loud, booms for our cats? Even the door or the phone bell ringing is a sound that is stressful to cats. And then the green you see here is other animals, right? So other animals are a source of anxiety for cats, even those that already live in the house with that pet. Maybe they're an indoor only cat and they see other pets outside, either being walked, or maybe there's, an indoor outdoor cat that is walking by outside. Anxiety trigger. So what does this mean then? Well, this slide is going to summarize the steps that stress induces upon cats. And it's believed that this is what is occurring in cats with FIC. So the cat with FIC perceives environmental stress. So the stress response system is stimulated. This enhances activity in the sympathetic nervous system and increases outflow down the spinal cord to the urinary bladder. In normal cats, or I should say, in otherwise healthy cats, this response is regulated or dampened, if you will, by activity of the hypothalamic pituitary adrenal input. But in cats with FIC, this isn't occurring. Increased sympathetic input to the bladder is thought to cause neurogenic inflammation, which then leads to increased permeability of the urinary bladder mucosa, greater access of substances in the urine to sensory neurons in the bladder wall, increased pain receptors or fibers in the bladder, and the release of inflammatory cytokines from cells in the bladder wall and increased sensitivity of afferent nerves. This sensory input then via afferent input, sorry, I always have to correct my accent comes out sometimes, usually when I'm using words such as via and afferent. I'm from New England originally, so I, take R's out and put them in other words. So trying to to articulate. So this input from the bladder is transmitted back to the brain, as we see here. Okay, and it's perceived as pain, which causes additional stress. So this becomes a vicious cycle and continuously repeating itself, affecting both the brain and the urinary bladder. So the key point here is that stress absolutely does affect the urinary bladder and the brain, and treatment strategies, obviously by the veterinarians on here, should be aimed at both areas to increase success of managing cats with FIC. Also, involvement of the central nervous system may explain why other therapies that have been directed only at the urinary bladder have historically not been as successful as, maybe we had hoped. So again, the pathogenesis of FIC involves a cycle, and that starts with chronic stress, which we just saw, right? Which leads to an abnormal stress response, which then leads to bladder inflammation and chronic pain. And this vicious cycle continues to the point where the cat is brought in to be seen. And here we have the cat in the cone of shame. The key to breaking this painful cycle is a multimodal approach that includes, again, as you can see here, stress management, right? Stress management for all cats, behavioral therapy, especially, in those cats that maybe develop a litter box aversion. What I want to focus on, nutritional management, and then pain management, especially during acute episodes. This is what we're trying to get back to, that human-animal bond, where everyone in the home is, for the most part, getting along, and this cat isn't so stressed that he's suffering from FIC. So I want to talk, again, I mentioned nutritional management. We're also going to talk about pain management. But with nutritional management, if we think about focusing on stress, because stress is, as we saw, such a huge component of this, I want to talk about a couple of nutrients. The first is an ingredient that's derived from milk. We know that milk contains a natural peptide or protein called alpha S1 casein. As you can see over here on the left, it's converted to a bioactive peptide, hydrolyzed casein, via hydrolysis with trypsin. Hydrolyzed casein is also known as milk protein hydrolysate, or alpha-casozapine. It has a natural affinity for the benzodiazepine site of the GABA receptor and has been shown to regulate anxious and stressful behaviors. So alpha-casozapine actually plays a role in cats with FIC, in their mood and their anxiety. And if you think back to the old wives' tale, I don't know if that's a politically correct thing to say. I don't know what else to call it, so I apologize. But, historically we've heard, oh, I can't sleep at night, so, why don't you, drink a glass of milk or warm milk? Well, I think that's where this is coming from, because this milk protein, this alpha-casozapine, has that calming effect, if you will. and has an effect to regulate anxious and stressful behavior. So mood and anxiety. Okay, let's take a look at this in a couple of different species. It's been shown to decrease anxiety in several different species. And if we look at these, we see decreased anxiety and stress-induced sleep disturbances in rats. We see decreased stress-related symptoms in people. And a more recent publication from the others, still not very recent, but it describes beneficial effects on decreasing stress and improved training in feral ponies. So why not take a look at this in cats? Have we seen anything in cats? Well, a randomized, double-blinded, controlled clinical study did actually evaluate the effects of casein or casein hydrolysate compared with placebo administered for 56 days to cats with confirmed anxiety or social phobias. And what was found was that alpha-casozepine was associated with a significant decrease in fearfulness and an increase in contact with people. Two of those, that we talked about are anxiety triggers for cats. So one nutrient, alpha-casozepine, I want us to think about. How about tryptophan? Does that play a role? Well, we just had Thanksgiving, right? For those of you who celebrate, and we always, think, oh, Thanksgiving, falling asleep, tryptophan. Well, that's part of it, in addition to the amount of food we eat, right? So, and so if we look at tryptophan here, it's converted to 5-hydroxytryptophan and then to serotonin. We know serotonin, right? Again, plays a role in mood and anxiety. So what happens if we increase dietary Ltryptophan in different species? Well, in people, we see improved coping ability and improved mood, and those are stress vulnerable people. We saw decreased territorial aggression in dogs and decreased owner-reported anxiety in dogs, which is pretty significant if the owners are reporting a decrease in anxiety. So what about in cats? Well, again, tryptophan supplementation on multi-housed cats presenting that were presenting stress-related behaviors. After L-tryptophan supplementation, what was found was less anxiety and stress-related behaviors with L-tryptophan added to the diet. So this is why I get excited about nutrition, because some of you out there may be like, oh yeah, nutrition, whatever. But nutrition plays such a role in so many different disease conditions. But here are two nutrients in combination with the nutritional profiles that we talked about more towards the beginning, the omega-3s, the antioxidants, that can help manage feline idiopathic cystitis. So that's one of the reasons why I get so excited about nutrition. So what about pain? Are we managing pain? Because we know this is a painful condition. And I'm sure many of you are, if not all of you are. Hopefully we're thinking about pain, because pain is what? The fourth vital assessment. So we have temperature, pulse, respiration, pain evaluation, and nutritional assessment. Those are the 5 vital assessments. So hopefully pain scoring systems are routinely being used to assess the severity of pain and to help you as veterinarians determine analgesic plans. And there's a whole bunch of them out there. This is one. This is the Colorado State University Feline Acute Pain Scale. We also know that there's the Glasgow Feline Composite Measure Pain Scale. There's the grimace, feline grimace scale. There's a whole host of them. So if you need one, just let me know. I can drive you to different areas where you can find pain scales for cats and dogs. So we do our pain evaluation, and then, you know, we should be thinking about what we're going to recommend for pain management. And you as a veterinarian, this is your realm, right? You know the pain meds, you know the pain meds that are best for cats with feline lower urinary tract disease. So in addition to pain meds, I'm hoping that you're also thinking of and using the Assisi loop, which you see here, okay? Because the Assisi Animal Health group, which is putting on this presentation, offers targeted pulsed electromagnetic field therapy. And this is a portable, as you can see here, easy to use device, right? And this is delivering a signal that's tuned specifically to minimize pain and accelerate healing. And it's stimulating the body's own natural anti-inflammatory process while speeding the healing of soft tissues. It most certainly helps with pain associated from or associated with lower urinary tract disease. As I've mentioned, it reduces pain, accelerates healing, and reduces swelling. I like it also because it's compatible with other treatments for pain and inflammation. So we mentioned that multimodal approach, right? So we have environmental enrichment, we have nutrition and specific nutrients, we have pain meds, we have the Assisi loop. And, you know, it can also reduce the amount of pain meds that need to be given. And so the loops targeted, again, pulsed electromagnetic field therapy delivers a microcurrent to damaged tissues that is 1/100th of the strength of a cell phone signal. And, you know, typically it's applied for a 15-minute treatment cycle, and it's precisely configured to trigger, as I mentioned, the body's own natural inflammatory process. It is really aimed at stimulating cellular repair by delivering that signal to damaged tissue in a way that upregulates the body's own production of endogenous nitric oxide. So this results then in accelerated healing and relief of inflammation and its symptoms of pain and swelling. So imagine how better our fluted cats, our FIC cats, are going to feel with this multimodal approach. Because what we're trying to do is stop this inappropriate elimination. Because if we go back to the beginning, inappropriate elimination is a very common reason why pet owners are bringing their cats into us. But it's also a very common reason why pet owners are relinquishing their cats to shelters. And we want to make sure that this isn't happening. Our goal as veterinary healthcare team members is fewer painful days, right? For the cat, for the family, and for the veterinary healthcare team. Because we've seen this. We know the cyclical nature of this. We know if the owners aren't compliant, that the pet starts to have issues again and needs to come in, right? So if we have a multimodal approach to reduce pain and inflammation and utilize nutrition, then we can hopefully have fewer painful days. The key to breaking the painful cycle of stress in cats with FIC, I've mentioned it, it's a multimodal approach: stress management, behavioral therapy, and, you know, with that, environmental enrichment. then on to nutritional management and pain management. And we've seen some of the tools that we have in our toolbox to help with this multimodal approach. We want to manage stress for all cats, right? And to do that, we have to use that multimodal approach.